Well, good afternoon, good morning, and good evening, everyone. Thank you so much for joining us here today in this conversation, the community call for the Capacity Accelerator Network. My name is Diana Fajardo Pulido. I am joining from Edinburgh, Scotland today, and I am the Community Engagement Manager for the Capacity Accelerated Network and data.org. I want to welcome everyone today. I'm just going to start sharing my screen. So today I want to, today we will be talking about our CAN community. Then we will have a speed networking, which is an icebreaker that we use for people to get to know each other. And then we will have the presentation of the Epiverse and our ecosystem for efficient and reproducible epidemic analysis. We will be joined by Abdel Nasser Digot from the Gambia, from the MRC in the Gambia and the London School of Hygiene and Tropical Medicine. And then we will hear from an Epiverse Fellow, Kenneth Enwerem, who will talk about his experience in Nigeria. We will have some time for Q&A. And then at the end, I will share with you some opportunities to join further our CAN network. So with that, let's get started. Chivan, can you reproduce the video? No.
Yes.
And before that, I want to remind you that this is a conversation. We want to do it very interactive. So if all your microphones are disabled, but you can raise your hand to speak. So please do so when we have the Q&A. Another way in which you can interact with us is to share any questions in the Q&A box. And you can please, in the chat, introduce yourself. Let us know where your name, your organization, and where are you joining us from. So the Capacity Accelerator Network, it's one of the initiatives of the data.org. We have 5 hubs around the world, one in Africa, another one in India, another one in Asia and the Pacific, one in the United States, and one in Latin America. We have this tremendous goal of training 1 million purpose-driven data and AI practitioners around these hubs and around the world. And with that, we are trying to train all the practitioners in Africa with Epiverse. So Chivan, can you please share the Epiverse video?
Yes. If you can stop sharing your screen, yes. I hope my screen is visible.
Yeah.
And let me know if the voice is audible.
When COVID-19
Yes.
Is it audible? I will start.
It's working.
When COVID-19 spread, the global response was scrambled. Tools were built from scratch. Data was siloed. Since then, a majority of the world has moved on. Funding has slowed, and many pandemic intelligence tools have been abandoned. But we can't afford to wait for another crisis to rebuild these tools. The infrastructure for prevention, monitoring, and response is needed now. That's where Epiverse, powered by data.org, comes in. Supported by universities, ministries of health, and NGOs around the world, Epiverse is a data analysis collaborative dedicated to getting ahead of the next public health crisis. Epiverse is a suite of trustworthy open-source software tools that help estimate critical epidemic factors such as severity, need for critical resources, and vaccine efficacy, as well as providing insights into seasonal diseases. Informed by local needs and strengthened by international collaboration, Epiverse is devoted to supporting data-driven decision-making for public health. We can't afford to wait. We must anticipate, identify, and prevent future public health crises today. Epiverse, data analysis for decision making. Email epiverse@data.org to get started today.
Well, so that's an opening for Epiverse, and that's what we are trying to do here, just to strengthen the capacity of all the global network that we have to attend the next epidemic or the next public health crisis, which I think is very relevant at this point because we are having an epidemic crisis right now in the Congo. So with that, so we open this space conversation as a community call series for knowledge exchange, collaboration across regions, showcasing impact and success stories, and amplifying their diverse voices of everyone who is working, who is a partner, or who is a learner within our network. Our community is dedicated to providing a harassment-free, inclusive, and welcoming environment for all participants, regardless of gender identity or expression, age, sexual orientation, disability, physical appearance, body size, race, ethnicity, nationality, religion, socioeconomic status, or education level. We prioritize the safety and well-being of marginalized individuals and communities over the comfort of those in position of privilege. Maintaining the integrity and inclusiveness of our community is a shared responsibility. So let's connect to each other. Is our speed networking time. What will happen is that we will call you into breakout rooms. You will have 5 minutes to stay in the breakout room, and then we will call you back. In this breakout room, we hope you can share your experience with an ice-breaking question that I'm going to share right now. And let's go to the breakout rooms. I see you there. So for the breakout room, I would like you to respond to these questions. Which data-related skill do you think is most critical during an outbreak response? Welcome, everyone. How was your breaking room? To your breakout room. I was very interested. I was with Rivash from Ajikistan, and he is working on renewable energy for hospitals, which I think it's very interesting because also when we think about data and climate change, we also need to think in the places that we are looking or caring for the people that is that is not well enough to be in their houses. We also need to think about the hospitals and the caring facilities that we have then. So thank you so much for that, Rishabh. If you have any comments on the breakout room that you were participating, please put the comment on the chat. I'm going to keep sharing my screen because it's time for us to present our first speaker. Yeah. So welcome, the good. The good, he lives in the Gambia, but he is originally from the South Sudan. He is the lead of research analysis at the MRC unit in the Gambia, which is a unit led by the London School of Hygiene and Tropical Medicine in London. His focus areas, his work areas are focus areas for research are mathematical modeling, outbreak analysis, and capacity building. And he's also been involved in Epiverse since day one, where he has helped to develop the Epiverse tools that we use for outbreak analysis and data analysis of epidemiological data. And he now is the lead of the capacity building fellowship in Africa. So welcome, Digot.
Thank you, Diana, for the introduction. So I'm going to give you a brief overview of Epiverse Trace project. And I think the case why Epiverse Trace project is already given in the introductory video. So what I'm gonna do in the short time that allocate to me is to walk you through how we did it and show you an example of case study that's useful for Epiverse Trace, and then I will mention something about this Epiverse Fellow program in Africa, and then give a floor for Kenneth. So how we achieve in Epiverse Trace in the first phase, which is about creating tools, because outbreak analytic is highly predictable task. There's certain analytical tasks you can predict from get-go. And so we developed this roadmap for outbreak analytic, which we categorize the tasks into three phases or stages: early stage, and then middle stage, and late stage. And so the task in the early stage is about preparing the data, cleaning them, standardizing them, and curating them for the subsequent analysis. And in the middle task, which is main activities of outbreak analytic happen, it concerns mainly about two tasks: about transmissibility and severity. And there is a grade of tools and models that people use to answer uh, those analytical questions. So we put them in the middle task. And in late task, there is about simulation and scenario modeling and comparing interventions. So these are the roadmap we put in a best trace approach. And so what we do is we create either new, if it's a gap, we can create a new tools to attend certain tasks, or to reuse an existing one, refining them. When we are building the tools, I mean our package, we build it in industry standard. We adhere to the best practices in open science and uh, and open software. So all in all, we have about two dozen of our packages. Okay, we devote it to attend those tasks. And the good thing is, this packages or tool has been creating in a way that they work together in an interoperable way. So they are connected to each other, and they are also connected with other tools that exist beyond what we call it our associate packages. It's not directly involved or created by the Epiverse Trace tool, but it has been because the way that we create the pipeline could work together with the other existing packages. And so that's our tool. And then here I would like to give you a concrete example of how our tools can be used in reproducing retrospective studies, or has been used in a contemporary study. So in the first study is about simulating the influenza H1N1 outbreak. Okay, just a simulation. And in the second, okay, and then the second study is actually about also predicting the outbreak, estimating the attack size or outbreak size for influenza, again for influenza H1N1 according to the age distribution. And the third one is about the scenario modeling for Ebola, for COVID-19 scenario modeling in 22. And then because of time, I don't want to go through all these studies, but the most important one about using one of our tools to project, okay, the number of cases in Gaza during the last war in Gaza episode. So in 2024, all in this, you can use a few of our tools. They are connected in an interoperable way to perform or to attain this analytical task. So central is Epiparameter, which is a package. It's a library for epidemiological parameters. We put them in one place. It's work with multiple other, because in order to do modeling, you need parameters. Some of them reflecting the natural history of the disease or some factor or characteristic of the disease. These parameters are scattered here and there all over in the literature places, but we put them into one repository and store them in a nice way so that the researcher can easily access to them and then reuse those parameters, okay, in doing the analysis. And so I think final size has been used to project the disease risk in Gaza. And also the EpiChain is a package of that used to simulate and analyze transmission chain used to do the simulation for the influenza H5N1 risk. And of course, one of our most important packages is epidemic, which is library of epidemiological and epidemiological models. Okay, it has a standard module. You can easily customize it and also allow you to inject interventions and compare simulation. So these are some of our tools. And so in essence, these three slides just was explanation of what those tools was doing from epidemic to final size to epichain, and in central to it is epiparameter bucket. Epiverse trace is also a training. It provides a lot of training material of different format for different audience. We have an ecosystem of tutorials, which has 4 types. I think we have training episode, whether you are focused in a theory or in application. There is quadrant, we have training episode, which is take you step by step to understand the context, or how to guide. If you just focus on how to do certain epidemiological tasks, you can just go to the how to guide kind of manual to ABC to attend a certain task. Or we have more lengthy background about theoretical aspect of certain tasks. You can check the package vignette or further reference material. Our software has been well documented. It has been well tested. As I say, it's interoperable. That's a key feature of our packages, and it has been built in a collaborative way. That means, we incorporate community ideas. Okay, we build it in an open software system on GitHub. Everything is open, and we also apply. Most of them apply for the stamp. They are stamped or certified by this initiative, the Digital Public Goods Initiative. That means it has a certain good aspect for integration, accessibility, and can be used to solve some real world problems. So that's about Epiverse, about tools, about how we provide training and educational resources. But the ultimate goal is to cultivate a community of practices that put all these tools in practice. Okay, existence of tools is one step, but the ultimate goal is to put them into practice. So that's the way Epiverse Trace Phase 2 is start. And so we have like 3 key objectives in order just to strengthen and scale up and extend this tool to put them into practice. And the first initiative was targeted towards Africa. We focus on 10 African countries, okay, and 3 of them in Francophone West Africa, 3 in Francophone, Anglophone, 4 in Anglophone West Africa, and 3 in East Africa to lead the adaptation effort on these countries. And so after highly competitive program, 1 fellow from each country has been selected. And those fellows, they went through a lengthy educational course. We call it Epidemiological Data Science Training for Africa across 3 stages. The first stage was target to give them background about R and data analysis applied by our partner, Applied Epi, industry partner. And then the Epiverse Trace Lag team provided basic in epidemiology and mathematical modeling. And then MRC and London School of Hygiene and Tropical Medicine together we jointly provide them the applied outbreak analytic course. So after equipping them, we send them to their field. And I should say that those fellows have been selected based on certain criteria. Most importantly, they should have an insider knowledge in their respective country, how they have close network for their Ministry of Health and health stakeholders in the respective country. They have a good understanding of NR, and they have, technological competencies. Those are the main features why a fellow has been selected. So they're going to be a vehicle for adaptation. So I should pause now and present you one of our fellows to tell his story and his experience, Kenneth from Nigeria. So I shall stop here.
Thank you so much, God, for that, for telling us a little bit where Epiverse come from. I was a very lucky person to start working with Epiverse in Latin America, and see all the stages in which we have developed these tools from easy tasks for cleaning data, epidemiological data, to the most advanced tasks, which are like creating models and projections for epidemics and outbreaks control. It's also important to know that we created these training materials that have been implemented and applicable to several regions in Latin America, Africa, within the English, French, and Spanish communities, and also talking about the implementation in Africa. But to extend further this implementation in Africa, I want to invite our second speaker, Kenneth Enwerem, who is our Epiverse Fellow in Nigeria, and he's going to talk us through his work and what the amazing work he's doing in this country. Welcome, Kenneth.
Thank you very much, Diana. Can you confirm you can see my slide?
We can see your screen. If you can put it on the full mode screen, thank you. That's perfect.
Okay. Thank you, everyone. I'm really excited to be presenting this. I'm very, very thankful to data.org, the Epiverse and CANVersation communities for offering me this opportunity. And I want to thank everyone that is really able to show up for this meeting. I just want to put a caveat here that I'm very, very grateful to all of my Nigerian senior colleagues and colleagues who are part of this. I think about 25% of the attendance from Nigeria. Okay, let's go ahead. Okay, so I'll be presenting on strengthening public health capacity across Africa. This is my experience as the Epiverse Fellow in Nigeria. Okay, so much has been said about Epiverse, so I will just kind of narrate the experience we've had from the beginning of the fellowship. So just like the good had mentioned, 10 fellows were selected from across Africa, West Africa, East Africa, and the southern part of Africa. Then we started by having a country stakeholders engagement in each of our countries. So in October of last year, I was able to bring together a high-level stakeholders meeting with over 35 senior representatives from key institutions in the country. Some of these strategic partners include the Nigerian Center for Disease Control, Federal Ministry of Health, the Federal Capital Territory Public Health Department, the UK Health Security Agency, US CDC, Africa CDC, and some academic institutions like the University of Abuja and Global Health Infectious Disease Institute, as well as my primary institution, the Institute of Human Virology in Nigeria. The main purpose of this meeting was to secure government endorsement and also align the fellowship's roadmap with national public health priorities, ensuring that our work was demand-driven and also integrated into existing surveillance system so that we are not running any parallel systems. Following this stakeholders engagement, we were also tasked to do a country needs assessment. This held between October to December last year. We looked at certain thematic areas of our countries. We looked at our country overview in terms of the population and demographics. We looked at the climate, economy, and literacy, key stakeholders in the public health sector of our country. We also studied the public health administrative structure, and when we looked at the infrastructure that is available for epidemic modeling and analytics, we also looked at the disease burden snapshots in the country and also the healthcare system structure. Key findings from this needs assessment include we were able to identify training gaps, major training gaps in R, modeling, data cleaning, automated workflows. Most people were just beginners in most of this. We also identified tooling needs, data availability bottlenecks. We also looked at institutional priorities, where the institutions wanted us to focus in terms of strengthening their surveillance systems, routine analytics, and building long-term modeling. We looked at the expected barriers to Epiverse tool adaptation, and we also identified opportunities for localization and sustainability. This country needs assessment was followed by a capacity strengthening for fellows. So the 10 selected fellows across Africa were engaged in a 6 months rigorous virtual training. This was culminated in a 3-day in-person physical training, which held at the World Health Organization's regional hub in Dakar, Senegal. At that meeting, we were also able to be guided to develop a roadmap for the implementation of the fellowship plans and activities for the year 2026. So these are some of the key achievements we've been able to achieve in the country in terms of building local capacities. We've been able to engage several institutions in the country, including the Nigerian Center for Disease Control, the Federal Capital Territory, our Public Health Department. We've also engaged different private groups like the R Users Group of the Federal University in Jigawa State. We've also engaged the University of Abuja Modeling Center. We've also partnered with certain credible institutions like the UK HSA to provide such training. We've also worked with the academics because we want sustainability for this program. We're trying to formalize a collaboration with the Global Health Infectious Disease Institute at the Nasarawa State University in Kefi to develop a postgraduate program, diploma program in epidemiological data science, such that even when the fellowship ends, there is continuity and sustainability for the Epiverse work. And we've also established peer learning platforms on social platforms like WhatsApp for mentorship of the people that we are building their capacities, and also growing community of practice. So this is positioning for pandemics. We all know that we have currently an epidemic of Ebola happening in the Congo, and the Epiverse packages are presenting. We can leverage on some of these packages, which allow for crucial scenario modeling and for optimizing vaccine distribution. These tools are now being introduced into the country's Nigerian health to Nigerian health officials. The Epiverse initiative, like was presented by the GOAT, was born from a need to maintain robust analytic tools post-COVID. Now we are actively working to prevent a future abandonware like what happened during the COVID, so that we can have something that's sustainable and always used when we have such pandemics coming to us. So for continental unity, our work is a part of a coordinated Pan-African effort. Each of the fellows in the 10 different countries in Africa leverage on lessons learned from each country to be able to provide some of this strengthening of health systems. We share a unified roadmap, and we're learning from fellows across all of the countries. So in a region currently facing an Ebola outbreak, this network and these tools are more critical than ever for rapid evidence-based decisions. So what are our next steps? Our next steps are to accelerate academic partnership. We are looking beyond the fellowship period, and we're looking to sustain all of the gains that have been achieved during the fellowship period. Therefore, we are looking at academic institutions that can incorporate what we've learned and what we've built as a curriculum and formalize it into what they teach in their schools in epidemiological data science courses. We are also looking to expand our training. Currently, we're training 20 students of the Master of Public Health at the Global Health Institute, Infectious Disease Institute. We are currently going to train 12 researchers at the Institute of Human Virology next week. This week, we are training 15 field epidemiologists from the Nigerian Field Epidemiology and Laboratory Training Program. In July, we are planning to train 15 staff from the Federal Capital Territory Public Health Department. Another strategy we are planning for is to deepen tool integrations. So to support the application of Epiverse tools like Epiparameter and Final Size to real-world public health data sets from the Nigerian Center of Disease Control, especially for outbreak scenarios. In closing, we have built the foundation. Now we are scaling it to create a self-sustaining ecosystem of data science expertise that will serve Nigeria's and Africa's ability to respond to public health threats. Thank you very much for listening. Over to you, Deb.
Thank you, Kenneth, for this impressive work that you are doing in Nigeria with the Epiverse Fellowship. It's really inspiring how you use this country assessment to understand the skills and capacities that you needed to work on with the workforce that is attending all the epidemic and outbreak. And it's also how this coordination will help with controlling the Ebola outbreak that is happening in Congo. And how are you thinking about the sustainability of this? So thank you so much for that, Kenneth. So before we go into Q&A, I would like to introduce you to people here. One is Lance Peirce. Lance is our new CEO who's been appointed as a CEO of Data.org very recently. So it's a pleasure for us to have you here, Lance. Welcome to Conversations. This is your first conversation.
It is, Diana. Thank you so much, and for that kind introduction, and thank you to all the speakers as well. I think this is such a good example of the work that we're doing, and I'm always struck by the observation that so many of these issues, these things that become crises are often predictable. They're often knowable in advance. And the good work that's taking place here in the Capacity Accelerator Network and Epiverse is really attempting to help people prepare better for those things. So, and as we all too often see, sometimes what starts as a small, localized public health issue of some kind, an outbreak, can very, very quickly become national, regional, and global unless there's an intervention of some kind. So it's just gratifying to see the good work. It's great to be here with the team and really looking forward to working with you all as we try to advance the field, advance the practice, and save lives in the process. So thank you. And Diana, please.
Thank you, Lance. And the second person I would like to invite here is Priyank Hirani, who is the director of the Capacity Accelerator Network, and he is going to talk a little bit about this joint community that we are building at data.org with Epiverse and the Capacity Accelerator Network. Priyank.
Thanks, Dan. Hi, everyone. I want to just sort of do +1 to what Lance said. It's really gratifying to be here and see how the different communities that data.org is helping shape interconnect and are able to sort of join together. Epiverse started 6 years back as a much more technical endeavor and sort of coming out of COVID, thinking about the creation of tools and supporting tools. But as all of us on this call know very well, unless we build the local capacities to be able to use those tools and embed those data analytics capabilities into the public health systems, into ministries of health across these African countries, we're not going to be able to fight the next pandemic together. And we are seeing that very much come alive into some of the health crises that the world is facing today. And that's why we are very, that's why for us, sort of bringing the Epiverse community alongside the Capacity Accelerator Network community, where we have been having other programs and thinking about building capacities at the intersection of, say, climate and health or financial inclusion and other areas, was our way of looking at a holistic picture for thinking about data and AI capabilities across different sectors. And so we very much welcome the Epiverse Fellows and the Epiverse Extended Community through the WHO Collaboratory to be part of the Capacity Accelerator Network work that data.org has been leading over the last few years. Thank you. Back to you, Diana.
Thank you, Priyank, for that. And now we are going to go into some questions. So if and discussion, if you have any question, please raise your hand and we can help you with that. And you can ask your question yourself. However, we have 2, 3, 4 questions in the Q&A. I'm just going to read that out loud. It says, as you know, the RC Democratic Republic of Congo is experiencing an outbreak. How can we engage to use the Epiverse tools to support response to the current situation? Digot, I think that question is for you. I also see that there are a few of the developers of Epiverse here. So if you want to jump in and help us answer these questions, you are very welcome. Yes, Digot?
Well, thank you for question. It's very relevant question. A week or 2 weeks ago, we presented in Epiverse tool for current Ebola outbreak analytic in Congo in WHO, collaborative pandemic talk that we presented the tool. So basically, you have tool for early outbreak analytic tasks for cleaning. Epiverse doesn't deal with collecting. Once you collect it, clean Epi, you can use to clean. Read Epi, if this data is stored in now the health application system like DHIS2 or SORMAS or in databases, you can use READAPI to access those data, provided that you have the credential. API parameter, okay? Of course, if you want to know any historical parameter about Ebola, you can find it in API parameters, and epidemic, and epi chain, and final size. Those are like data hungry. We need to actual data come from the ground. For example, the contact tracing data. As the pandemic evolve and those tasks that can emerge, then you can use the more advanced tool. So that's what I can recall from our presentation of presenting those tools. But my colleague Josh is here. If he can add more, he is more of the technical side. He can fill in the gap if I miss anything. Joshua,
Yes, I'm here. Thank you. Thank you very much. Yeah, nice to be here. Thanks, Digu. Nice to see everyone today. Thanks for putting on this call. Yeah, a bit of background. I was on Epiverse as a software developer between 2022 and 2025, and was the primary developer of packages such as Epiparameter and Simulus and Superthreading and a few others. I think it's a very relevant question, right? So with the current situation in DRC. I guess my main point to answer the question that's in the Q&A would just be to contact someone in the Epiverse team, and they can probably put you onto the relevant person who's dealing with the package. So that might be myself for certain things, but may also be other people who are around. The sort of the beauty of having them as open source, open software packages is they're in a sense malleable to context. So things can be adapted to the current context in the DRC BVD outbreak. But the same goes for any future outbreaks that we may see of known or novel pathogens. So I think perhaps Digu, you may want to nominate yourself as that point of contact, or other people on the call. But yeah, I'm happy to interact with people if they're thinking of using Epiverse packages, especially those that I've been involved in. We'd be more than happy to collaborate and assist in the work, in the response work. Thanks, over.
Thank you, Good and Joshua. We've shared the links for you to understand a little bit more about the Epiverse tools. So please go and join the web. You can check the website, check the GitHub, and if you find something interesting, please let us know so we can connect you, as Joshua said, with the developer or who is in charge of the package, and how can they can help you to use that with your data. We have another question here, and it's about the Epiverse data science training. So we will be sharing that in the chat in a few minutes. So don't worry about it. We will. They are free of use, so they are open source as well. So we will share that with you, so you can take those training courses. Remember, they are in Spanish, English, and French. The next question is about, are fellows working with the government, special ministries, and how? Kenneth, can you help us answer that question?
Thank you very much, Diana. I think that's a very interesting question. If you had looked at the slides, the first thing we did as fellows and in each of the countries was to do a high-level stakeholders engagement because we needed to have some buy-in, both from the government and private institutions that were dealing with public health in the country, as well as also academic institutions. So that's a very, very important thing. We had to liaise with all of the stakeholders to ensure we have a buy-in, to ensure that we're doing things that were based on demand and based on the priorities of the given country. Yeah, so the government is aware of that. And in fact, I have one of the government officials on call here, who is the state epidemiologist in the Federal Capital Territory in Abuja. yeah, you can also confirm it. So yeah, the government is very, very involved.
Yeah, thank you
Thank you
so
very
much,
much.
Kenneth.
Yeah.
I think, yeah, the implementation of this wouldn't work if we could not work with the government and the public health specialists, because they are the ones that know how to implement this in outreach within the countries. So, and then we have another question: as individual, how can I join the work if my country is part of the 10 selected? Digo, can you help us answer that question?
Okay, can you reiterate again?
Yeah, I can just jump in. So if your country is I mean, if you're part of the country where there is a fellow, you can reach out to the fellow. We can put in a link or something where we have contacts of all of the fellows in each of the 10 countries, and you can reach out to the fellow of that country and see how you can collaborate and support.
Thank you, Kenneth. Yes, you can find all the fellows that are working in Africa in our data.org website that will be also shared here, or I will send all the links in post email with the recording of this conversation. And we have a final question. This is from Elichama, and it's for Kenneth. Given the capacity building work you have going on in Nigeria, where do you see the opportunities to apply these skills and tools knowledge to relevant use cases within the country? Or are there any ongoing as part of your work with the government and academic institutions?
Okay, thank you very much. That's a very interesting question. Yeah, so we've worked very closely with the Nigerian Center for Disease Control to implement some of these capacity building activities. We've helped them in outbreak analytics. We've also worked closely with several other institutions, the Federal Capital Territory, Public Health Department. So most of the work that we're doing is helping in outbreak analytics in the country, especially with diseases like cholera, Lassa fever. Currently, we just had the Lassa fever outbreak season, which is about ending in the country, and some of the capacity strengthening helped with that. So the work that we're doing is helping the work that is going on in the country public health system to alleviate some of the conditions that are available. And you can always reach out if you need to collaborate or partner with us in any way. Thank you, and over.
Thank you, Kenneth. So we are running out of time. And then if you have any further questions, please send it through to us, and we can help you to connect with the Epiverse team. I'm just gonna share my screen with some further kind of opportunities to join our network. So right now we have the Data, AI, and Policy Hackathon open, where you can with the APAC regional the Data, AI, and Policy APAC regional competition is for university students and recent graduates who want to build practical, responsible, and user-centered solutions for financial health. So if you are interested, you have some experience with financial health, please join this important hackathon. We are sharing all the resources in the chat, so please do go and for further information into the links. And also we have the Climate Change AI Virtual Summer School. Our partners at Climate Change AI have opened the 4 virtual summer school This is an opportunity to learn about different applications of AI for climate action through lectures and hands-on tutorials. So also, please, if you're interested, please go into the link for more information. I want to thank, and finally, I want to thank, first, I want to thank Kenneth and Digot for sharing with us their experience working with Epiverse and the important achievement that Epiverse has come through this year with the fellowship in Africa. But also for reminding us the importance of having these tools for outbreak response. This was very inspiring, and I hope everyone can go and look at the training materials and get yourself updated with those. I also want to thank the Epiverse team, the data.org team attending this meeting. And finally, I want to thank the 100 plus partners that we have now shaping our Capacity Accelerator Network ecosystem. This work wouldn't be possible without you. So thank you so much for that. Please join our next conversation in September. If you want to showcase your work, you can let us know at info@data.org. And that's it for me. So thank you so much, everyone. I hope you have a rest of the evening, day, or afternoon. And see you in our next conversation.